Uganda's population is characterized by high population growth rate, which is the third highest in the world, rapid rural-urban migration, and wide inequalities in opportunity and income. About half of the population is less than 15 years of age and 78% are below the age of 30. Despite this, the coverage rate for sexual and reproductive health services is extremely low, especially for youth-friendly sexual reproductive health services. Only 5% of public health facilities in Uganda provide youth-friendly sexual and reproductive health services. This situation is aggravated by glaring statistics. 1 in 4 girls aged between 15 and 19 years is already a mother or pregnant with her first child. There is high unmet need for family planning, standing at 34%, meaning that on average, 3 out of every 10 women do not wish to get pregnant, but they are not using any contraception, even when they are sexually active. With such sexual reproductive health statistics, Reproductive Health Uganda has developed unique project interventions and approaches with best practices aiming to champion, provide, and enable universal access to rights-based sexual reproductive health rights information and services to vulnerable and underserved communities, especially young people.
Reproductive Health Uganda is a member association of the International Planned Parenthood Federation, a global agency that promotes sexual and reproductive health with a presence in 150 countries globally. We have a big network countrywide with a network of 19 clinics spread across 18 branches.
A large number of girls still join the streets every day as a way out of poverty. More than 2 million girls join the sex business every year, whether harmful or not. Prostitution is one of the booming businesses in Kampala suburb of Waise, Chimombasa slum, with over 250 young girls joining the business every year. The Shadows and Light was a project implemented by Reproductive Health Uganda. It aimed at promoting and providing integrated sexual reproductive health and HIV services for sex workers and other key populations in Kampala.
Yali 2007 netufuna okumanyisibwa nti waliwo ekitongole ekize ekigenda okuyamba banneeko.
Training akutiki okumala wiki namba
nga bamaze tusomesa nenjigamu nange okusomesa bannange ng'endwadde STDs, HIV AIDS, no counseling bannange.
The services that we offer family planning, STI screening and treatment, HIV and other services.
Byenfunyemu amazima gali nti nze nali sisobola kuwambaza musajja condom.
Ndizemu okugira kyalaani kuba nkera kumacha ne bandeetera engoye nefunamu kwezo sente lesobola oweerera omwana wange.
Naye RHU tuyigiriza butumira eddagala etujjeeko omusaayi etukebedde kansa kitegeeza buli ekirwadde kyonna ekyali ku tteneeko RHU eryo tubeererawo.
Kintasizaako ku bulamu bwange kuba olwengendayo bankebera bampa ne ku kondomu zenkozesa neno ne bakasitoma nenjigamu n'okukansolinga bannange.
RHU yatuyigiriza nga ate netusasulira buli kimu netuyiga without paying any money.
Ate n'ekirala banneeko tebamanyi kuwandiika.
Kayingola zino different language services ekitegeera otakubaddeyo ne basomaye naffe tweteekyo nga kigenda kusomesa banneeko.
At least ayige okuwandiika erinnya lye, ayige okulamuza mu luzungu n'omusajja singa abafunye omusajja nga muzungu.
We have challenges of course of drugs and supplies. We subsidize the prices for the Moonlight Stars, but still find because the Moonlight Stars are many, we have trained 90, still we are not able to meet the demands of the Moonlight Stars.
The Access Services and Knowledge Project, ASK, aimed at promoting youth-friendly services to young people between 10 years and 24 years of age. The 3-year project aimed at overcoming the barriers to access sexual reproductive health services that young people face as a result of lack of quality services, lack of sense of empowerment and knowledge, social stigma and discrimination.
I get to know about us project from Joshua RSU to Rural Branch.
I also went to a place where they were testing and I was tested So I realized about RSU.
I acquired knowledge of abstaining.
I also came and advised my wife that we should go for family planning.
In Tororo, we are blessed that the clinic is really located at the center, surrounded by a number of secondary schools, and you find that the access to the services by the young people is really good.
Let me say teenagers have got family planning of this 3 months.
Peer educators, they always advise them and don't play sex without condoms.
As project, we should recruit more peer educators and train them, because right now it is only functional is in few sub-counties.
There should be more of, sensitization. They should move door to door.
Apart from only testing people for HIV, STDs and so on.
They can give us like pads, medication, advising us.
The Transient Trade Project, implemented in Mbarara, was a 5-year project aimed to reduce the incidences of HIV infections, unwanted pregnancies, and sexually transmitted infections among vulnerable young men and women aged 15 to 29 years engaged in transient trade like market vending, long-distance truck driving, and luggage couriers.
I came to know about the TT project from a friend of mine called Chris.
It came in the community looking for transient traders.
And these include the barmaids, border riders, shoemakers.
Using a sexual reproductive health rights approach, the project sought to increase adoption of safer sex behaviors and increased utilization of HIV and social reproductive health services. Part of the activities included interpersonal groups and mass behavior change communication, capacity building through orientation of peer educators, equipping outreaches, clinic and youth centers to provide quality youth-friendly and gender-sensitive sexual reproductive health information and services. The project reached over 96,000 trans traders with sexual reproductive health information over the target period, and a total of 78,388 clients were served with a full range of sexual reproductive services and in outreaches in the project target area.
I happened to get a skill of computer repair and maintenance. Those people helped me a lot to get that thing out of me.
I can even attribute my behavior change to the TT project, because I would say I was kind of reckless, You meet a girl, you just go to bed, there's no protection, no nothing. But 2011, I had to get married. So you can see the transition of being reckless to, being a responsible man. So I'm a married man with one kid, and, it's a good life. I can say I've gained a lot of it.
When those girls joined us, RHU supported us with knitting machines, the tailoring machines, saloon machines, to help those girls get the practical vocational skills so that we can live the other life. We have other girls whom we think still need these services, but we have challenges of sustainability. The funding ended. If another project can come and target such groups, it can be good.
And if there's a donor that is willing to invest in this kind of project, we would be very grateful. And I would be willing to volunteer to, help them out.
We work in a gender-aware manner to reach as many people out there as possible. We also try to involve men in the area of reproductive health.
Our services have been creating a lot of impact in the society as we go around complementing the work of government. In 2015, towards the end, we launched a new strategic plan which spans between 2016 to 2022. In this new strategic plan, we have 4 outcomes we are aiming at, and that is: one is to engage government, to ensure that they implement sexual and reproductive health policies in terms of programming, in terms of funding. Second outcome is focusing on young people to promote education, sexuality education, and we have an ambitious target of training 250,000 young people in sexuality education. We have an ambitious target of reaching 5 million young people with comprehensive information.
We are appealing to you out there, whether friends, partners, organizations or governments, to come together and support us in this noble cause. We want to build our capacity in the area of training our staff. We want to train our staff to be better equipped with the knowledge and the attitude to offer the services to this population. We also appeal to you in terms of infrastructure. We have a number of clinics out there, but these clinics need to be built up. Some of them need to be renovated. We need more equipment, we need more supplies. Our outreach teams need to be empowered with resources, with fuel, so that they can reach out there with vehicles and other equipment so that we can reach as many people as possible in the shortest time possible.
We are very grateful to the government of Uganda for having partnered with RHU all this far. We are very grateful to the UN agencies who have been working very closely with us. We are also partnering with so many other development partners, not to mention, and bilateral institutions. Despite the funding architecture, we in reproductive health, because of the formidable impact we create, our trajectory continues to rise higher. 8 years ago, we were providing 8,000 couple years of protection called CYPs. Right now, we are talking about over 200,000 CYPs provided. That means we are averting a lot of deaths, a lot of abortions, a lot of planned pregnancies, which we feel is our core mandate. We are looking forward to cultivating more new strategic partnerships such that we can venture into new areas as the world moves on. We are positioning ourselves to be a strong contributor of the social development indices and to significantly contribute to the national development plan of the government of Uganda.